So just want to take a moment to make sure you understand how to use the equipment after surgery and the rhythm of using that equipment. So this is obviously the CPM machine, continuous passive motion machine. And when you actually wake up in the hospital and you'll have had your spine on your block, you won't even be able to feel your legs. And this will be going 0 to 90 degrees. And that's really the goal for the first 2 weeks, is 0 to 90 degrees. So you want to make sure you have it on correctly. It's not that heavy, maybe 30 to 35 pounds, and get it set either on the bed or a separate bedroom or a couch. And then the settings should be 0 to 90 degrees. And I'll go ahead and start it here so you can see it run, but if you get it set and you can't tolerate it on day one when you get home, you can back down to 60 degrees on the remote control. It's quite easy. You just hit it's really not even, it's just the picture of the bent knee, and then go down to 60. And then once you tolerate 60 degrees for 10 minutes or so, then push that button again and go up to 70 and then to 80. But the goal each 2-hour session is to get to 90 degrees. Okay, so each session the goal is 90 degrees, which is where we are now. And so if you can't tolerate that, you can back down to 60. But in that 2-hour session, the goal needs to be get up to 90 degrees. And you'll watch as the knee goes down, because we obviously have a machine under the leg. It's sometimes very difficult, especially if you have dressing on, to get the knee completely extended. And so that's why we don't stay in the CPM longer than 2 hours, because then we need to work on what we call extension, or getting the knee completely straight. So Colby, without any dressing on, easily we get it out to 0 degrees, not a problem. But with the dressing on and a little bit of surgical swelling, that can be difficult. But again, it's a 2-hour session, goal 0 to 90 degrees. If you struggle with that, drop back to 60 every 10 minutes, keep going up until you get to 0 to 90 degrees. All right. Okay, so this is we call it the Bone Foam. It's actually from a company called Bone Foam. The specific name is called the 0 degree knee. And so the reason it's called a 0 degree knee is right now Colby's knee or his leg is at 0 degrees of extension. So in the CPM, we went up to 90 degrees of bending or flexion. We're now at 0 degrees. It would be much more comfortable to have a pillow under the knee and be a little bit flexed, but the number one complication of a knee replacement is the inability to straighten one's leg, and then you walk with a limp. So this was designed specifically to eliminate that. So you have the ice pack on your knee that was given to you in the hospital. Just get it out of the freezer, put it on, put the knee or the foot in the Bone Foam. Make sure there's a little bit of space under the knee here, so we've dropped down to 0 degrees. The goal is 1 hour, 30 minutes minimum, 60 minutes maximum. Then you'll take all this off, get up, walk around, go to the bathroom, get something to eat. You'll get in the CPM machine for 2 hours. You'll come out of that, get up, go to the bathroom, walk around the house, get something to eat, get back in the Bone Foam and ice. And that's the rhythm to the day, 30 to 60 minutes, walking, CPM for 2 hours, walking, 30 to 60 minutes, Bone Foam and ice pack. The walking is important to prevent clots, pumping those calf muscles. We do give you aspirin for a couple weeks, but really it's the pumping of the calf muscles that does not allow clots to develop. So again, for the first 10 to 14 days after surgery, what is most important is just the rhythm of the day with the Bone Foam, ice, walking, CPM, Bone Foam, ice, walking, CPM. And if you do that, you should recover very, very well. Therapy is excellent, but really it's the second phase. First phase is concentrating on range of motion.